What were easily curable and treatable diseases become very difficult to even salvage and often are leaving patients with permanent damage. So COVID-19 is a respiratory virus described in 2019. It derives from the coronavirus, which we previously knew to cause the common cold. However, what we found is this is much more serious and impacts patients on a respiratory level more severely. One of the most fearful complications of COVID-19 is myocarditis. This is a disease in which inflammation affects the heart muscle. As far as we understand, this isn't a direct result of the virus, but it is a result of your body's immune system trying to combat the virus. And as a result, your immune system creates inflammatory elements that deposit in the heart. This, as a result, can create long-term effects, including scarring of the heart muscle, leaving it much weaker. Others, though, have recovered, but as this is an ongoing process, we are still learning as well. So another complication of COVID-19 as it relates to the heart includes the formation of clots in the arterial system. These clots may occur in the heart arteries or the lung arteries and can be detrimental to patients. The treatment for this is usually blood thinner, and oftentimes patient can recover. Lastly, we are seeing electrical disturbances of the heart. So a very common arrhythmia known as atrial fibrillation often accompanies patients with a serious COVID infection. Luckily, we've seen the reversal of this once the COVID resolves. A healthy heart is the best way to combat complications of COVID-19. That means eating healthy, maintaining your exercise routines. We've also seen that supplementation with zinc and vitamin D helps to improve your symptoms and adverse effects from a COVID-19 infection. Lastly, it's so important to continue your routine visits with your doctor to make sure that any preventative measures that can be taken are available to you. When it comes to heart disease, heart attacks are emergency situations, and what we've seen is patients are fearful of coming to the emergency rooms or even their doctor's offices, and as a result, there's a delay of care. Unfortunately, when they do present, oftentimes these healthcare systems are inundated and overwhelmed, and that even puts a further delay. What were easily curable and treatable diseases become very difficult to even salvage and often are leaving patients with permanent damage. So my recommendation is, despite all that's going around, if you feel that you may be having a heart attack, it's very important to call 911 and come to the emergency room.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos. We upload informative video content every week.